be educated, but I'm so frustrated.
This is Dr. G. I hope everyone is doing good. So today I am coming to you guys with some tips about some applications that can actually help you when you're working in the hospital. And it doesn't just apply to doctors or medical students or residents. It also applies to nurse practitioners or PAs, just because these are resources that I found to be helpful when I'm working either in a hospital, emergency room, or even in the clinics as well. So today I have 7 applications, okay? And these are apps on your phone that you can easily pull up to look up things. So these are the resources that I use to kind of help me out, and most of my colleagues use the same resources as well. And there are easy go-to applications on your phone where you can just kind of pull them up and look up what you need. Basically just trying to see if there are things that you may have overlooked during the course of treatment. The first app I have is a very common one. Everyone uses it. It's UpToDate. We like to joke in our residency, UpToDate, it's our Bible around here. But the thing with UpToDate, sometimes you can get buried in it. You can get lost in that rabbit hole, just, because it goes from one condition and then, oh yeah, click here. If you wanted to look up XYZ, click here. And then you would just sit there looking up stuff forever and not even just focusing on what you came there to look for. So just keep that in mind. My next app is Medscape. I will tell you guys, this one is my favorite. I am a Medscape person. Like, Medscape is really my go-to. A lot of times just because it's so easy to find things. It's super intuitive. So trying to find drugs, trying to find dosages and stuff like that, you can even calculate inside of the app. Especially, I use it also like if I'm prescribing medications for children and I'm not exactly sure like how much to prescribe given their weight, height, all of that stuff, because that criteria, it's really important. You have to really pay attention to demographics of children when you try to prescribe to them. They have this section called e-medicine, so I love using that as well. Like if I'm working in the emergency room, there's a great utility to Medscape when you're working in the hospital. So app number 3 is Hippocrates. Hippocrates is very similar to Medscape. There is a free version, there is a paid version. For the most part, I think Medscape has been free. Ever since I've had Medscape, I've never had to pay for it. I've had it for many years. Even before I became a doctor, I was using Medscape like as a nurse practitioner, even in med school, all of that stuff. So with the paid version of Hippocrates, you do have more features that come with that. But I think it's about $185 a year. That's what I pay for that. But ever since, I think for the last year or so, I've actually discontinued my subscription just because I have these other apps that I've been using. So that's number 3. Now let's go ahead and move on to app number 4. App number 4 is another favorite of mine these days. If you love hospital medicine, if you work in hospital medicine, if you do acute care, so you're an acute care nurse practitioner, a PA that works in acute care, a doctor works in acute care, internal medicine, family medicine, hospitalist, whatever the case might be, as long as you are in the hospital. This app is called the Hospitalist Handbook, okay? And just like the name though, it's also just like that little Bible, just having things all concise for you. Guys, this thing has got sections for admission checklist, discharge checklist, everything based on systems, cardiology, GI, renal, whatever condition that presents itself. So a patient presents with decompensated CHF, or a patient presents with acute exacerbation of COPD or acute respiratory failure, whatever it is, secondary to pneumonia, secondary to COVID, whatever the case might be, this handbook has it. I actually found out about it recently and I have been using it a lot. It comes very handy in residency. As far as payment though, the Hospitalist Handbook is free. All right, guys, let's talk about app number 5. And this one's called FP Notebook. Basically means Family Practice Notebook. This one's excellent for those that work in outpatient primary care, just because it gives you a list of like differentials, treatment algorithms, things that you might be overlooking when it comes to treatment and management of your patients in the outpatient setting. So it's called FP Notebook. You can get a desktop version. You can also get it on your phone. I normally would just use it on my phone. It's only about $20 a year, and I mean, it's not expensive. It's awesome when you're in residency, especially if you're in family medicine residency just because you're seeing a lot of outpatients. It helps you guide your differentials, guide your treatment algorithms, helps you with the screening tests that you might be forgetting and stuff like that. So basically a good reminder of, all of the bases that needs to be covered when you're treating the patient. So our app number 6 is called Sanford Guide. I use that mainly for antibiotics. I use this a lot also, especially inpatient, when you have your crazy gram-positive bacteremia, vancomycin, and then you have gram-negative bacteremias. Of course, you add the cefepime and stuff, and then sometimes you have your crazy bugs, or say you start treating the patient for endocarditis, and I'm thinking, how long is he supposed to be on therapy? Is it 5? Is it 6 weeks or whatnot? Let me double check on that. Or just some oddball like bugs that come out of nowhere that you're treating these patients for, and then you want to look through the guide and stuff, and it basically just guides you. And then sometimes too, what you've been taught in medical school, now the patient is allergic to that. Let's say, yes, okay, first line treatment for patient has gram-positive bacteremia, you want to do vancomycin, but boom, you hear this patient has anaphylaxis to vancomycin. Of course, you got to go to the next one on the list, right? Are you going to do linezolid? Are you going to pick something else on the list or whatnot? Can they even handle it? How's their kidneys? Those kind of things. So it really does guide you through that. Sanford Guide is awesome. That's mainly for antibiotic therapy. The other thing you can also use for antibiotics, if you work in the hospitals, most hospitals have what we call antibiogram. They come up with like a new antibiogram to tell you, okay, what is endemic in this area, what antibiotics responds to treatment in that area. For example, something like azithromycin, everybody knows azithromycin it's already gained like significant therapy resistance in a whole lot of places and stuff. So whatever antibiotic that is not working in your area, the antibiogram will also tell you that as well. So the other thing that some of us who use, especially if you work in the emergency room, is this MRA antibiotic guide. So this is awesome too. They have it for I actually have another one for pressors, like working in critical care, those kind of things. So different kind of pressors, especially if they're like new pressors that become available on the market. Those are really helpful for that. MRA's got like a whole bunch of these little tiny books and stuff. My only drawback when it comes to like using these books and things like that is, over the years, new information become available. They do studies and stuff like that, and then sometimes these things are out of date. But a lot of times with the apps and stuff, a lot like these app developers, at least the good ones, they try to stay on top of things and then try to update that just like in real time, so if the information or the treatment guideline has changed as of 2022, they'll go back in there and update that. But let's say you bought this about 2 or 3 years ago and then information has been updated. Of course, you realize like you're still working with old data, which might not be the most evidence-based. MD-Calc. Everyone should already know about MD-Calc. It's awesome. And it's also free, guys. MD-Calc, you basically use that for scoring, right? Calculation of a whole bunch of things. We like to say, especially in family medicine, we deal with a lot of the scoring system. Okay, so like the Wells score or Wells criteria, this kind of thing used for, DVT or pulmonary embolism to try to see what is their risk. Should I order D-dimer? Should I just go straight and do Doppler ultrasound, or does this person actually need a CTPA to check for pulmonary embolism? So that scoring system, MD-Calc will help you with that. Or your TIMI score, your heart score, when a patient has, acute coronary syndrome, that kind of thing. Like what is their risk based off of the scoring system? MD-Calc is awesome with that. MD-Calc is amazing. You can use that to calculate a lot of things. These are like numeric values, right? That actually just tell you where is the patient on this prognosis scale there, how bad are they, as far as like your calculated risk score, are they pretty bad or are they moderate risk, low risk, high risk, whatever. And that's basically what we use those for. So MD-Calc is the last one. It's basically free. I've never had to pay for MD-Calc. It's been free since medical school, which is when I started using it, and it's still free now. I hope they keep it that way. I mean, I know it would have been nice if all of these apps were free, right? But of course, some of them are super expensive. And of course, the most expensive on the list will always be up to date, right? It's just a collection of peer review articles and journals, evidence-based, everything that people bring together and say, hey, this is the right thing to do. Not everybody follows it. Sometimes they do, sometimes they don't. But anyway, guys, that's all I got for you. These are the main apps that I use. I know there are many more apps, but oftentimes it's better to kind of keep them concise. See what works for you, pick that one, and then stick with it, okay? But anyway, I'm going to go ahead and stop here for now. Until next time, please do not forget to subscribe. I appreciate you guys. If I don't say it enough, please know that I appreciate y'all for subscribing, your questions, your comments, and everything. Until next time, y'all. Thank you. It's Dr. G.